Well, seeing additional cases pop up in the United States is very possible.
Here in Idaho, healthcare providers are being extremely cautious, getting ready in case Ebola shows up in the gem state. Lehr joins us live in the studio with details.
Don Michelle, because the patient in Texas was in the area for several days before being isolated, health officials wouldn't be surprised to see more Ebola cases in the immediate community. They are, however, confident that our high-quality health care could combat the deadly disease.
In light of the growing Ebola outbreak in West Africa, health officials in Idaho aren't surprised to hear a case of the disease was confirmed in the United States.
We've been preparing for this, and hospitals and emergency departments and public health agencies have all been planning to get ready for this.
Hospitals in the Treasure Valley are briefed daily on the current situation and keep personal protective equipment, pharmaceuticals, and other supplies readily available.
Most hospitals in Idaho now have special isolation rooms in place that they can use or could use if they needed to for possible Ebola cases.
More than 20 of these rooms are already frequently in use at St. Alphonsus Hospital in Boise to prevent other airborne illnesses from spreading. The clearly marked rooms have a prep room allowing doctors to wash their hands and put on necessary protective gear before handling the patient.
So it's really helpful to healthcare workers to protect them from getting infected.
These rooms also have a specialty air system in place to pump air out of the building instead of recirculating back into the hospital.
I think the chances are very low that we'll see Ebola here, but certainly not zero, and we do want people to at least be aware.
Those most at risk are anyone who's traveled to West Africa within the last 21 days, seeing extremely visible symptoms.
They're not having mild sniffles or whatever. They're coming with fevers, vomiting, diarrhea, very, very sick people, and they are needing hospitalization and care.
And although the fatality rate of Ebola cases are high, the CDC is confident in their abilities to deal with any possible cases here in the United States.
The CDC has a special team in Dallas to monitor everyone who was exposed to the Ebola patient, and anyone with potential symptoms will be isolated and monitored closely. Live in studio, I'm Lehr. Today's 6 on your side.